Welcome to your free low back pain video, where you will learn why you have back pain, how to cure it, and how to prevent it. Before we get going on the video, I want to give you my credentials so you will see why you should listen to me with your back pain problem. I am a 1985 graduate of Palmer College and board certified in chiropractic. I am a 1989 board certified chiropractic neurologist, and I have practiced for over 26 years. I have written several books and hundreds of articles and have taught seminars for many years. So let's get going on your video so you can understand your low back and the pain you have and how to get rid of it. It is well documented in the literature that the more you understand about a functional problem, the better you will deal with it, and the better and more easily it will be cured. In this video, you are going to learn about the structure of the low back, about the function of the low back, the interrelationship between structure and function, and how to change the abnormalities that develop and the functional problems that develop in the back. If you have a normal functioning back, it is usually a pain-free back. So let's get going. First, let's discuss a little bit about the structure of the low back. In the normal low back, there are 5 individual bones sitting on the sacrum, which is part of the pelvis. There is a certain curve called lordosis in the low back, and there are hundreds of muscle attachments with 9 ligaments holding bone to bone. So it is a very complex structure, both from a physical standpoint and from a neurological control standpoint. This is Dr. Robert Bates at Leominster Chiropractic Spine and Injury Center. Today we're going to discuss the disc in the low back and what are disc lesions and the various types of them. I'm going to use a model to explain so that you can get a much better idea of what is really going on. This is a model of the low back in the human. These individual bones are vertebral bones, and there are 5 of them in the low back. Separated between the bones are intervertebral discs, this structure. And the disc, this represents a normal disc. The disc is actually made up of 2 parts. The outer layers, approximately 15 layers, called the annulus fibrosus, and the center part is the nucleus pulposus, which is about 80% water in a healthy disc. So what you have are thousands of fibers that come from this annulus fibrosus and attach into the bottom portion of the vertebral end plate or the bone. So it's actually a very strong structure that is attached integrally into the vertebral end plate or bone. As a matter of fact, if a disc is healthy, then the bone will fracture with violent motion before the disc will tear. So that is why we know that disc lesions are always chronic. This represents a disc bulge where you can see the annular fibers have become weakened and the jelly is starting to push through and make a bulge. Now, this represents a full-blown herniation where the discal material has ripped through the annular fibers and is actually starting to touch this nerve root. That's when you get the sciatica or the radiculopathy and the leg symptoms, the weakness, the numbness, muscle atrophy, and all of the problems that can become a severe problem and permanent. When they do disc surgery, they go in and they actually try to avoid these nerve roots, and they rip out part of this bulging part, and that is really the fix. There's nothing else that's done. It just stops irritating this nerve root. So actually, when you have a disc problem, this is a normal disc. This is a bulge. Then you have a herniation. There are other words called extrusion. There is free fragment, when a piece of the nucleus actually breaks off and can move up or down and affect other nerve roots. Several things come into play depending on the actual dimensions of the person. The space in here is the central canal space, and in some people it is smaller, and they can develop what is called a stenosis, where there's not enough room for the nerve roots hanging down in the low back. You can also develop arthritic problems in the posterior joint, which is here, or off of the end of the vertebral body, which is here, and either one of them can start to take up space here and cause a lateral stenosis, and again affect the nerve root. So to understand how these disc lesions occur, it is nothing wrong with the disc itself. It is an abnormal motion pattern that is because of weak muscles, shortened muscles, torn ligaments, shortened ligaments, stretched ligaments, and many other abnormal things that can occur because of posture and trauma and daily activity that causes an abnormal motion pattern and starts to tear the disc and cause bulging. So there's an abnormal function in the low back years or at least months before any disc lesion occurs. And that is why going to a chiropractor and making sure you have normal motion at each level becomes so important to prevent these serious problems that after the fact take much longer to heal. As a matter of fact, there is no direct blood supply to the disc. It absorbs nutrients through the end plate of the bone, and therefore the metabolism of the tissue is very slow, and when you herniate or bulge, it takes a long time to heal. So that is the description of the disc. One more quick thing is when you sit, you should be keeping the lordosis in your back. And when you do that, you are in this position, which puts pressure on the back of the disc, keeping the nuclear material forward. When you sit in slump, like this, for long periods of time, you're putting pressure on the front of the disc, causing a constant migration of what we call hysteresis and creep, where the nuclear material continues to push backwards, and that's when you start to develop disc problems. The reason that most people have low back pain is not based on an abnormal structure, although that does come into play. But the correlation on X-ray of an arthritic condition and the amount of pain is almost zero. There are many people with a lot of arthritic changes and structural changes in the back that do not have pain. And the reason is they still have a fairly normal function in their low back. This is something that is difficult to measure and is not even looked at with most medical treatment. If they can't find a fracture or an abnormality or severe arthritis, then they don't really understand what the problem is. And that's why a very large amount of medical diagnosis is called idiopathic back pain, or I don't know the reason why you have your back pain. So from a functional point of view, we have a certain amount of curve in the low back called lordotic curve. We have all of these ligaments and joint capsules and muscles functioning to have normal motion. The bottom line is there's a certain amount of normal motion in flexion, extension, lateral bending, and rotation at each segment, which makes up the global motion, or the motion that we see for the whole lumbar spine. This motion drives a lot of sensory information into the central nervous system and helps protect you by creating little bits of muscle contraction and regulation of normal movement. We're going to talk a little bit further in this video about the things that change this function, which ultimately lead to back pain. This is Dr. Robert Bates. Today we're going to go through some of the core stabilization exercises, which is a necessary component of almost any low back treatment program. As a matter of fact, today, if you do not perform a specific exercise program, if you have had a back problem, even one episode today, then it is not considered a credible program. So it is critical to understand that 90% of the stability of your low back is muscular. So let's go through some of these core stabilization exercises. It's very easy for you to know after starting and trying these how stable your low back is. You may be, as many of my patients are, quite surprised how weak your core muscles are. And you are a walking time bomb for a back problem, even if you have not had one, if your core muscles are weak. So let's take a look. We perform 7 types of core stabilization exercises, and I will go through these so that you can have a good understanding of how you actually do them. There are many variations depending on the strength of the individual and what we need to start with versus what we're going to end up with each individual, depending again on what they have to start with and what their problem is. So the first one that we do after warm-up is a prone plank, and we perform prone planks, and if the patient is in some decent condition without a lot of core weakness, then we do a one-legged prone plank, and when we lift the leg for 5 seconds we bring it laterally so that it creates some torque in rotation in the low back as well, so it's just a lot better exercise with more sensory input into the cord. We go 5 seconds on each side, back and forth, and we do about 15 of these, again depending on the condition of the patient. When we have the patient getting through this very easily, we add half-pound weights on the ankles, and we go up to a pound, pound and a half, again to try to fatigue the muscles and get above that 80% level so that we get some enough fatigue in the muscle to cause some growth. I will now go through a couple of the other exercises that we do. One of the most important ones is the lateral plank, where we are firing all of the core musculature except for the rectus abdominis. We're firing the internal, external obliques mostly on the bottom to bridge the spine, and I usually have the top leg a little bit in front. We do about 30 seconds or so on each side, and again, when the patient becomes somewhat stable, we use very small weights that we place on the hip to further the load. We start with 3 pounds, we go to 5, we'll go up to 8 pounds, and we will fatigue each side, and we'll end up doing 30 or 60 seconds, again depending on the conditioning. Now, if you're pretty weak, and a lot of people are that have a back problem, they can't even get in this position. They cannot hold themselves up. So we will start from the knees like this, which is much, much easier. It's a much shorter lever arm for the back. So once they can do this and they build up some strength, then they can start to begin to do the full-length plank. The next type of core stabilization we do is we do a couple of different abdominal exercises, and the first one we do is where we balance like this, and we pick the knees up, and we have a little bit of rotation back and forth, and again fires the internal, external obliques, the rectus abdominis, and it also sends a lot of sensory input into the cord because you have to balance. We'll talk a little bit more about balance in another section, but that is a very critical point to bring up and discuss and understand to have stability. It should be noted that if there's a shoulder problem or just a lot of deconditioning, you can perform the prone plank on the elbows like this. It is a bit more stable for the patient. And again, if they are very weak, they might need to start on the knees and then build up to a full-length prone plank. Another exercise for the abdominals would be just to perform a very small lift like this. And remember, the rectus abdominis goes from the symphysis pubis to the lower sternum. So a full contraction of the rectus abdominis is this. That's a full contraction.
I do not like to have people have their knees all the way up and have their lumbar spine coming out of lordosis. A lot of people prescribe the movement to be performed like this. I would rather see the legs down some to prevent flexion of the low back. We all spend way too much time in flexion already. So you can load with your arms a little bit up, it makes a little more exercise, or if you're weak you can have them down here and you're just going to lift up like this. Hold for a little fatigue, about 5 seconds, go back down and do about 15. Again, try to fatigue to failure. Okay? And never put your hands behind your head. A lot of people still do that and force their neck into flexion. Again, very bad. You can hold them here, but don't put them behind your head. Probably the most important exercise that we perform is based on some of the literature that came out in neurology about 1.5 to 2 years ago now. And they showed that what happens is there's a reflex in your low back, and when you sit in slump, meaning that this is not, curve is not staying here, you're in slump like this, slouched position, you stretch ligaments that are critical for a reflex to protect your back. And since so many people do sit a lot today, there are many people that hurt their back simply because they have abnormal neurological control. So this exercise actually drives a lot more sensory input into the cord when you add a specific movement, as I'm going to show you. This is called a bird dog or a cross crawl exercise, where you lift opposite arm and leg. But the new research shows that you lift the opposite arm and leg and then you make a controlled movement. And what I use is a 7-inch square. So I go up, out, down, in, up, out, down, in twice, switch sides and do the same thing. Up, out, down, in, up, out, down, in. The more that you try to be exact with that movement, the more you will fire the pathway. And that article in Neurology showed that you have about 10 times the amount of firing from your brain into those pathways that you're trying to grow the musculature. So it's very important to try to make that controlled motion. The easier it becomes, the more you want to try to be exact with it. Very critical for muscle building and for neurological control. And again, a lot of back problems are an abnormality of neurological control more than weakness, although most of the time there's both to certain levels that are. Another muscle that is very important for stabilization of the low back is the latissimus dorsi muscle. It is the muscle that attaches on the back of the humerus or the upper arm, and then it comes down and attaches into the fascia or the lumbodorsal fascia, the connective tissue in the low back. So the strength of this movement firing that muscle is critical to help stabilize the low back, even though it's an upper back arm muscle. Because when you go to pick something up, that muscle fires and stabilizes all the connective tissue in your low back. So how we exercise that muscle is we do rowing. We perform these types of exercises like that. Extension of the arm, and again, you'll usually get fatigue in the bicep or the brachialis or the brachioradialis before you'll really feel fatigue in this lumbodorsal fascia connection or the latissimus dorsi. But we do want to increase the strength and the cardiovascular capability of that. Another easy way to perform core stabilization is with a ball that you can pick up at almost any athletic store or even Walmart. And for $20 or less, you can buy one of these 55 or 65 centimeter balls that are good for an adult. The benefit of this is that it is very safe as well as it fires a lot of other good information into your central nervous system because you need some balance to do this. So you can perform a very good extension exercise for your low back just by laying over the ball, and when you first start you can leave your knees and feet and hands on the floor until you feel more stable. And then what you will do is you will do extensions without your hands or with your hands at the beginning. And as you become stronger, you can bring the ball further away from your head, which requires a little bit more activity, and you can perform a nice full range of motion extension exercise. And again, you can add small weights as you progress, and again, it fires balance, which is critical to help normal control, musculoskeletal, neuromusculoskeletal control in the low back. You can also perform lateral activity with this, again at different degrees of difficulty, sideways like so. And again, abdominal exercise by sitting on the ball and then rolling it into position and then performing excellent flexion activity. And again, where you put your arms, and if you have little weights, you can increase the resistance. But it's a very safe way, and you notice that I need to be watching balance, which is so advantageous for these types of problems. Another very important part of low back stabilization and proper functioning of your low back is, again, to increase the agility of your total neuromusculoskeletal system. Many of us, after we're a child, we no longer run around, jump, play, and climb, and we lose the ability to have good agility, which is incorporating sensory information from the joints, muscles, all of the connective tissues, and using that to have proper muscle function for coordination. As we get older, we have, all of us develop some mild losses of sensory input, and it is called a multiple sensory deficit, where you might not have the eyesight to give you information quite like you used to. You may not have inner ear vestibular function quite as good as it used to be. The sensory input from various joints and things that become a little arthritic is abnormal or doesn't get into the central nervous system because of cell death. And we have various types in the upper neck. You can have stiffness, which in the human is very important for joint position sense. So with this multiple sensory deficit, it's important to be driving more sensory information into your cord and keeping those pathways in your central nervous system active and functioning well. So as any part of a low back problem, we use certain types of balance boards like this one, which you can see has something that's a little bit rounded on the bottom. This is a medium type where it's not too difficult. They make various types. Some are easier than this, some are harder than this. We also use air pads, which are a little bit different but do some of the same things. So what we do with this is we position the patient on these, and we have them try to stabilize without losing balance. And as they get better at it, then we will have them move their arms around and move weights around so that they can develop better and better balance. And because of plasticity of the central nervous system, you can have these pathways develop more and more, and you would be amazed how good your balance can be if you practice it like anything else. So some type of balance activity with the balls that I've shown, with exercise and with a balance board is very critical to having a functioning nervous system, including a functioning low back that won't give you a problem. And again, when you try these balance boards, you will see how good your balance is. Some people are amazed how bad it is. Some people are amazed how good it is. But it depends on what they've done and how much damage they have through their life. So again, very important for many aspects, and even prevention of falling, things like that are, for instance, 70% chance of dying at 70 if you fall and break your hip. Within 1 year, 70% of people are dead because they're deconditioned, they don't have much of a safety margin. They atrophy at 3% per day with total immobilization, and if they don't have much reserve, it's a big, big problem. So again, exercise, keep that good reserve, and prevention of falling doing balance activity. Very important. I hope that you enjoyed this video and got some important information that will help you keep your back healthy. But remember, you must reduce your sitting time because it creates chronic problems that will give you back issues in the future. And when you do sit, sit in proper lordosis with good back support and get up as often as you can. Keep your low back strong by doing core exercises, and always remember that good nutrition, enough sleep, clean water, and additives like omega-3 oil and other things to reduce a pro-inflammatory state are important. You can always call me at 978-798-1853 and I can discuss your problems with you. Don't forget to see a good chiropractor to keep all of those small joints moving normally in your low back. Yours in health, Dr. Bates.